Dear professors and colleagues, it's my great honor to participate today in this meeting with my presentation on chronic venous ulcers. My name is Ayman and I am a vascular registrar in Aberdeen, Scotland. Chronic venous ulcers are the most common type of leg ulcers, accounting of 70% of all chronic leg ulcers. They remain a persistent challenge. They are difficult to treat and recurrence rates are high. At the same time, the evidence is constantly evolving and new research continues to refine best practice. That's why this topic is so important for our daily clinical work. Accurate diagnosis is a key. Starting with duplex mapping helps us to identify whether reflux is coming from superficial, deep, or perforator veins, which allows us to tailor treatment. On the other hand, APPI assessment should be always performed before compression therapy, but we must be cautious, especially in diabetic patients, because arterial calcification may falsely elevate APPI readings. Management of chronic venous ulcers relies on three main pillars. One, venous reflux treatment, combining compression therapy with targeted venous intervention to correct the underlying reflux. Second pillar is local wound management. This includes selecting appropriate dressing, debridement of the necrotic tissues, and treating the infection. Third pillar is addressing the associated factors, such as controlling edema, optimizing diabetes management, and recognizing when ulcers have mixed etiology. Now, moving to the significant recent study. Our first study is EVRA trial, which was published in 2018, and that showed that early endovenous ablation significantly improves healing and reduces recurrence rates in venous ulcers. This study actually included 450 patients across 20 centers in the UK, giving us strong evidence to support early intervention. Another meta-analysis by O'Meara in 2018, including 78 RCTs, showed that the importance of optimal compression compared with different types of wound dressings. Compression remains a cornerstone of treatment. Evidence suggests that multi-component systems with an elastic bandage are more effective than those with mainly inelastic component. In fact, four-layer compression systems are superior to short-stretch bandages. A meta-analysis of 48 RCTs, including over 4,000 patients, provides strong support for this approach. Prevention of recurrence is just as important as initial healing. The single most important factor is long-term adherence to compression therapy. We must understand that to improve compliance, we should focus on comfort, providing donning aids like the one in the picture there in the slide, and maintain consistent follow-up with patients. These strategies greatly improve adherence and reduce recurrence rates. To summarize, chronic venous ulcers are challenging but manageable with an evidence-driven approach. Diagnostics, early intervention, compression therapy, and long-term patient support are crucial. Thank you all for your attention, and I hope this presentation helps you to bridge evidence with your everyday practice in managing chronic venous ulcers. Your commitment to patient care truly makes a difference. Thank you.